We've got our featured speaker is here today, and it is Dr. Flowers. By the way, we want to honor him by celebrating him also because he is in part of Black history. Harvard graduated, cardiologist, saying he retired, but he's here working all the time. So we can't get rid of him, but we love him and give him a big round of applause. He's got a quick presentation that he wants to do.
He wasn't joking when he said I was supposed to present this. Quickly, he says, I tell you this and I read this. Let me read this first. I just want people to know that it was not always easy for a person of color become a professional in this country. And I have here the name of the first African-American MD in the United States. His name was James McClure Smith. And of course, most of these people that I'm calling out, they became physicians later on, not going to med school at 20, but maybe 30s and later, because it was such a struggle to get to that point. So he was born in 1813 and died in 1865, right after the Emancipation Proclamation. That was the first. Now, he practiced 25 years. The first woman doctor was Rebecca Crumpler. She was born in 1831 and passed away in 1895. And she had such a struggle becoming a physician that, unfortunately, 5 or so years after she got her degree, she passed away. Primarily because of poor health care for people of color, and because she had to struggle so hard to get through med school and so many resistance that she met. Had very poor health in that kind of situation. Now, how many have you heard of the American Heart Association? Okay, would you believe that the American Heart Association initially was a white-owned organization? In fact, now how many of you have you heard, let's see, you know about Morehouse? You know about Howard University? And would you happen to know Howard University medical school was first established because white people didn't want black people to go to school with them. A person of color could not get an MD degree unless they was in special training, go outside the United States, that kind of situation. So Howard University and Meharry University were established in the late 1800s. And that was established to have a place for a person of color to get an MD degree. Let me read this statement. Medical education for those seeking a career as a physician surgeon were limited to a few black medical schools, including Howard University in D.C., Meharry Medical School in Nashville, both established by whites in 1868 and 1876. Now, don't think they were doing you a favor. Because she said time out. Okay, all right.
Thank you, Dr. Flowers.
So the top things that we do are, what are the most frequently asked questions? And this kind of gives you like a little thumbnail print of what we do for Alzheimer's. What's the difference between dementia and Alzheimer's disease? The best thing that I can tell you is dementia is a broader term. Alzheimer's is one type of dementia. Most commonly affecting people of color is something called vascular dementia. That's a dementia that's precipitated by having poorly managed hypertension, diabetes, high cholesterol, and other things that we call cardiovascular risk factors that Dr. Flowers is going to discuss a little later. Okay, how do I know if I'm at risk for memory loss? We know that here in the state of Georgia, 50% of all Medicare beneficiaries have 4 or more chronic diseases. If you have 4 or more chronic diseases, high blood pressure, diabetes, high cholesterol, a cardiovascular diagnosis like atrial fibrillation, thyroid disease, COPD, chronic obstructive pulmonary disease, rheumatoid arthritis, those are risk factors for developing a dementing disorder, okay? How do you diagnose it? It's a process. As I said before, you start with your primary care doctor who makes sure that what they're looking at is not something related to something that can be fixed. Are you taking the right medicines? Are your medications having an interaction that is causing you to be a little confused and maybe foggy brain? Do you have an infection? Do you have an untreated sexually transmitted disease, unmanaged HIV, unmanaged syphilis? Creates dementia. That's the problem behind the Tuskegee experiment. It wasn't that they just rounded these people up. It's that when there was a cure or definitive treatment for syphilis, they did not provide it to people. Okay, latent syphilis causes dementia. Latent untreated syphilis causes dementia, okay? That's why they do a syphilis test when they're doing a dementia workup. So, can my PCP diagnose dementia? Of course they can. If they're familiar with it and they're comfortable with it, they can start the process. That's how it works. How do I prevent dementia? All the stuff that we're telling you today. You gotta eat right, you gotta exercise, you gotta pay attention to what you need to do to keep yourself healthy. The biggest risk factor for developing dementia of any kind is prolonged age, but also managing chronic illnesses and trying to prevent things before they happen. So with that, I'm going to reintroduce to you Dr. Cornelius Flowers, who is supposed to be a retired cardiologist, but he comes out to see us and he helps guide some of the educational content that you get for this session every month. And he's always got a little pet peeve or two. Come on, Dr. Flowers. But the important thing, because this is Heart Month, and Heart Month is every month as far as I'm concerned for people of color. Dr. Flowers has gifted us with a little bit of history for Black History Month, so we're all in keeping. You know, we've got the ethnic thing going on, we got heart disease going on, and we got representation in the room. So at this time, I'd like you to meet Dr. Cornelius Flowers. He's a retired, I should call him cardiologist emeritus for Emory Healthcare. You know he's from Mississippi. My husband's from Mississippi, and consistent with what he was telling you, the state of Mississippi sent my husband to Meharry Medical School so that he could get his dental degree. That's not long time ago history, that's recent history, okay? So don't be frowning on HBCUs like Morehouse, Meharry, and Howard, and now University of California, Davis, which are medical institutions that are designed to get underrepresented people in healthcare. As my husband's expression is, and you guys will understand this, the white man's ice is not always colder. Dr. Flowers.
Good to see you guys here today again. I'd like to start this conversation off. I'm calling it a conversation because it's this conversation. And I was thinking of this question. I was reading the other week, and it says, because I'm talking about exercise and diet and how it affects your health. Let me ask this simple question, just to get us in the right frame of all of this. What do you, the most active muscle in your body is, you know, you run, you walk, you hunt, you head towards, and all this stuff. What do you think the most active muscle in your body is?
Your heart.
Y'all get a, I think the heart guy get an A+. Because many times we do things because that's how it was done before us, or that's how things is. And if you really think about yourself, you really think about health care, you really think about being healthy. It's about a healthy heart for life. Think about, if you think about that, if you think that your heart is the most active muscle in your body, then you can realize what I'm about to talk about in the next 15 minutes. Think about it. How many times do you pump your pec? How many times do you squat your calf and your gastric muscles? Think about it. Your heart beats 60 to 100 times a minute, every minute, 24/7. So it's always moving, always going. And think about that. And also think about if that's true, why is it doing it 24/7? To keep you alive. And if you think about that, well, that's the most important muscle of the body I should be working on. That's body. Not working on my pet, my 6-year-old grandson. He's so funny. He's taking a little self-defense thing in first period. And he said, he called me G-Paw, and my wife G-Ma. He said, G-Ma, look, I got a bump on my arm. I got a bump. He had a bump on his arm, okay? And that was important to him. But what we need to start teaching people, let's talk about that bump in the chest, their heart. Now, if you could change your health to live a better and a longer life, would you?
Yeah.
If you could have a better understanding of the aging process and how they relate to disease, would you? Now think about this. In our people, in the people of color, the biggest thing that we see, high blood pressure, diabetes, obesity, and related illness. Nobody ever talk about our social situation, stress, where you live, your environment, but that's important. Now, what can we do to improve all that? That's what I want to talk about briefly. Now, that's some facts. The leading cause of death in the United States, heart disease. Nearly half of adults have heart disease. And experts predict that the number for heart disease will rise. Now, let me clarify that for you, because I think it can be looked at, can be misinterpreted. Just like the incident of people with dementia will rise. Let me explain that to you. When I was I went to med school. My first medical school was in 1976. My first day, 1972. And one of the things that really impressed me is that they used to say that Black folks didn't die from heart attacks. They just say that back in the 40s and 50s. And I finally figured it out, why Black folks didn't die from heart attacks. They died when they were 30 years old, when they were 40 years old, of being murdered, killed, on high blood pressure, and having strokes. So they didn't have a chance to have heart attacks. So that fills in that as long as we live, the average lifespan of a Black physician back when I started med school was like 58. Now it's probably close to 80. That's because we are doing better things and taking care of ourselves. Now, the incidence of dementia is going to rise. It is predicted that at the age of 80, probably, if not 60%, 7% of the people who are living will have some form of cognitive impairment or dementia. Remember what Dr. Parker said now. I didn't say Alzheimer's disease. Okay? See, let's keep that clear. Alzheimer's disease and dementia is dementia is the big category. Under there, you got Alzheimer's, you got Lewy body, you got heart, you got all those other 4 or 5, and the big one for us, vascular dementia. And that's the one you can do something about if you do a few things I'm gonna tell you about today, okay? Now, who's mostly affected by all of these heart diseases and these dementias and strokes? Black folks. And why? Because we have not got there yet with all the things that we can modify in our life to change those things. And that's what we want to educate you about. And I was very glad that we had the diet, they had the milk, they had the salad. I mean, come on. We don't, that's what we need to be going towards. Now, what are the contributing factors to premature heart disease? Remember, Cornelius says how the brains and the heart interact. Well, same thing. Hypertension, obesity, diabetes, cigarette smoking, elevated cholesterol, and fast. They are the same risk factors for having dementia, okay? Because you get those, you don't get dementia. And 20% of your blood that you have in your body goes to your brain. Think about it. Your head is not 20% of your side, but there's a lot of blood flow in your brain, a lot of vascular. Have you ever seen anybody get cut on the head or something? They don't bleed like, I want to say a stuck pig, but basically it bleeds a lot because it's very vascular. Just like if you had the blood flow to your heart being reduced by arteriosclerosis to those vessels and blockage of the coronary arteries, and it doesn't work well, and have heart attacks, and then the other things. Think about the brain. You affect the blood flow to the brain, you get similar. It's just, don't think clearly, you have strokes and that kind of stuff, and that all that tied into that whole process. Okay? And these are some other factors: disparity in health, socioeconomic, education, lack of exercise, physical and psychological stress, unfavorable dietary habits. It is well documented that your education level determines, it's a very strong risk factor in determining your risk for getting heart disease and dementia. And it's basically because of the education. The more education you get, that's why you guys are here. You guys are being educated. You guys are a select group compared to age and other characteristics. You guys, by doing these things we're talking about, will live longer than a match person of your same age and background who didn't get this type of information and didn't follow through with it. So this is what it's all about. Taking care of yourself so we'll last longer. It's not about lasting longer, it's about lasting longer and being better as we last longer, being functional. And I went, I recently joined the senior citizens. And one of the ladies said, "What you doing here?" I said, "I am a senior citizen. I am in the, I'm not gonna say my age, but I'm over 7, I can tell you that." But she said, "No, you're not." She said, "I see why you're a better way now. You're staying active, doing stuff, and that's what's gonna keep you young."
Yep.
All right. Now here's a little prescription I wrote for a healthy heart and a healthy life and a happy heart. Reduce sodium intake. It's been proven that if you reduce your sodium intake by half, you can reduce your heart disease, hypertension complication by 30 or 50%. Avoid a lot of alcohol. I didn't say don't drink alcohol. Avoid moderate alcohol consumption. Don't smoke, don't vapor, cigarettes, the pipe, and that kind of thing. And have a happy marriage. Now, it used to be proven that if you're married, hey, come on, guys. If you're married, you go to church, you live longer. Hold on a second. Now, alternative, if you're not married, get your pet. No, there's a large study that's been going on for at least about 30 years. The Southern Cohort Study, I'm a part of that study. And I just finished completing mine every 3 years to see your questionnaire. I just finished completing mine. You know what they heavily focus on? Are you married? Do you have somebody you can talk to when you're upset? Do you have somebody you can lean on when you need something done? That's what all this about. That's brotherhood. That includes your survival, reduce dementia, reduce reduce stress. Why is diet important? We talked about this in our other section, not in detail. We know about the Mediterranean diet, about the DASH diet. The big focus is low sodium, low fat, low cholesterol, eat them few fruits and vegetables, 6 to 8 helping a day. Okay? Why is exercise important? It has been proven that 150 minutes of exercise per week reduce cardiovascular disease, cerebral vascular disease, and overall cardiovascular morbidity, mortality, and also reduce dementia. Okay? There's a couple of reasons. It reduces stresses and also improve the cardiovascular system. Now, I don't want you to do 150 minutes at one time. You can break it up. I usually tell people do like 30 to 40 minutes 4 times a week or something like that. And I recently joined LA Fitness. And for you guys who don't know, if you have Medicare, LA Fitness is free, man. It don't cost you nothing. And they have these machines, you can go in there and put in your age, your height, your weight, and it'll calculate what your heart rate should be. You put cardio fitness, and it'll automatically adjust that to get it what's supposed to be automatically. Cool up and warm down and cool up. Warm up and cool down. So that's important. Now, when Cornelius mentioned in the beginning here, she said, we have changed a few things. She said, we have the exercise at the end now. She said, we want to wait until your food get all digested and stuff. Now that's very crucial. You don't think about that. Now, when you eat a meal, the blood flow in your body start preferentially going to your GI tract. So your brain and your heart have less blood than it does before you eat. And you know, I remember when I was a kid, said, never eat and go swimming. You know, that was, I mean, nobody never explained why, but you know, because your muscle will cramp up and you have less endurance. So that's why, you know, that's why we're gonna let y'all, let that food sort of ruminate a little bit. And so we can, when you exercise, you have all that going in your muscle. I think they're looking at me, I'm about to speed up. 5 minutes. Also, exercise. Why is exercise important? It tunes up your muscle and your heart and your cardiovascular system. That little heart there, it tunes it up. Now, the key factor about exercise, when you exercise, you always don't go out there and start exercise. You warm up and you stretch. About 5 or 10 minutes of stretching can reduce injury, improve your performance doing exercise. And when you stop, don't just stop all at once. It's like a shock to your heart and cardiovascular system. It's like high speed, you stop, then your blood pressure goes like, then you feel dizzy and all the other stuff. You cool down. There's a 5 or 10 minute cool down and 5 or 10 minute warm up. Right. So a 30-minute exercise may take you 50 minutes or 60 minutes because you're gonna warm up, you're gonna go out there and stretch. You know, if you guys join the Silver Sneaker, they have a whole bunch of stretching exercise. You know, they got one for the neck and one for the, they just tell you what to do. It's real simple stuff. It's not a lot of stuff, you know, and you can do it right there in your bedroom. It's all on YouTube. So that's important. So exercise is crucial. It reduces stress. It improves your brain, how your brain works. It makes your brain work better. Okay, we talked about the diet already. I'm gonna jump over that. Preparing yourself to participate. Remember, all of us who are over 50, When you go and start an exercise program, make sure your health is in good shape. As far as if you're diabetic, make sure your sugar not 300. If you're high blood pressure, make sure your blood pressure not 180 over something, or low, 90 over something, because that could be detrimental too. So you go by your doctor and then sort of check you out, then make sure your blood pressure is okay, make sure your chemical okay. And also, some people may actually need to have their oxygen level checked. Making sure when they exercise, their oxygen level doesn't drop too low. And that's not hard to do. It's just one of the little pulse oximeters you can get in this drugstore. You can buy it at home. Everybody should have one at home. Stick it on your finger to tell your heart rate and your oxygen level. And that's crucial, because if those things get out of position, you could be in trouble when you exercise. Okay? Let's see. Now you're clear about the doctor. I've talked about the stretching and warm-ups, which is crucial. And don't eat before you go out there and start exercising, for the reason I just told you. And this slide here look at the benefit of exercise. It's a lot of benefit. Reduce depression, reduce stress, reduce anxiety, protect your brain health. It helps manage pain, because if you have pain in the muscle, that muscle, if you stretch before you exercise, you can get that stretch out of there. And when you exercise, you improve that flexibility, and that muscle will not hurt the next time you begin to exercise.
Dr. Flowers, thank you so much for an excellent presentation. Hey, listen, the reason I'm doing this is because I know you guys have a lot of questions.
Yeah.
And so we're gonna get it started. By the way, if you have a question, please, present it as a question.
Okay.
Commentary and, I have a question for you.
Okay, go ahead.
So one thing that we talked about several months ago with Dr. Collins, your boy, your homeboy.
Yeah, okay.
We talked about dysfunction. Okay, and how that relates to your heart.
Yeah.
Can you tell us a little bit about how that works and what could we do to improve that?
Dysfunction, you refer to muscle or physical?
Sexual.
Oh.
I didn't want to say it. I thought you knew.
We're talking about ED, and how can that affect your sexual dysfunction? Okay, first of all, just like your heart is a muscle, your penis is a muscle. Okay, and there's blood flow that goes to your penis just like it goes to your heart. Okay, now if you exercise, that improves your vascular responsiveness, your arteries. You didn't know this, but your artery does this all the time. When your heart pumps, that blood goes out there, your artery expands, and when it relaxes, the diastolic pressure comes down, okay? It does that all the time. Now, if you have vascular disease from lack of exercise, poor diet, stress, whatever, that artery doesn't bounce too much. So when that young lady walked by, it's like this, and then those hormones sort of kick off, and if it doesn't relax and let that blood flow in there, you won't get that erection, okay? So exercise improves that. And some people even said a routine exercise program is just as good as Viagra.
All right, LA Fitness. Okay, so Roberson's going to work this side of the room, and I'm going to work this side of the room. So I know y'all have questions, so we're going to start with this gentleman right here, and then we'll get one over here on this gentleman.
So the men I'm friends with, we have a litany of Viagra, Cialis, black honey, Manuka honey, your Himbe, Tonkat Ali, regimen, natural herbs for sexual proclivity. I have had extreme success with Cialis. But
What's the question?
The question is, what are the signs I should look for as it relates to the side effects of Cialis on them? I'm 70 years old, and I don't want this to become, the side effects to become an issue as I'm moving towards 75.
Okay, side effects. There are some rarely visual impairment, but the big thing to remember about Cialis, those phosphodiesterase Cialis, Viagra, the biggest thing to remember about those is that what they do, they dilate stuff. And they're not smart enough to just go to the penis. They go to the brain vessels, the other vessels, and all that stuff. So what happened, unfortunately, in men of this age, a lot of people have heart disease. And they may be on a nitrate or a medication that reduce the vascular resistance in the artery, because that's what you do. Make it more relaxed so you can get more blood flow to your heart. So if you take one of those medicines and say you take a nitroglycerin for chest pain, what that would do, it would accentuate a drop in your blood pressure. In other words, your blood pressure is already 100 over 70, and then you take, you get some, you feel a pain, take nitroglycerin or your own nitrate, your blood pressure with the medication may drop to 90 or 70 or something, and that would not be good.
Okay,
You may not survive.
Okay, we've got one question here.
Dr. Flowers,
Yes.
When you talk about cooking, they tell you that salt is important, but when you talk about heart disease, they tell you that salt is not important. So what is the balance in that situation?
Yes. When you drive your car, they tell you that gas is important to make it work, right? Yes, salt, your body has salt in it. It's the excess amount of sodium. The excess amount of sodium causes impairment of your vasculature, and it raises your blood pressure and retain more salt and water in your body, which also run your pressure up. Now, we eat way too much sodium. Now, the 2-gram sodium diet that they recommend, in fact, there are some people recommend even 1-gram sodium diet. And it's hard when you cook to know what's a 1 gram. So half teaspoonful is most you should use. Now, I tell you how I do it. And I'm gonna tell you like what Steve Harvey was talking about. Listening to him comment on the radio. He was talking about how he grew up in the poor neighborhood in Virginia, and how the first time he flushed a toilet, but when he went to Cleveland and all that, you know, y'all know what that means. First time he turned the faucet. Now, and what he said is, you know that sodium is bad for you. He said, now I told you how I deal with it, he said, you got to figure out how you're gonna deal with it. Let me tell you how I deal with it. I don't even put salt in my food, period. I cook no salt in the food. Now you may need a little taste. You may get some little cinnamon put in there, a little spice, a little herb, something to get the food taste.
Yeah.
Now, salt is important to a taste. That's what it's good for. Taste and preservative. That's what salt does. So you got to figure out how you get yours. Now, if you cannot control your sodium, then just leave it alone then. Like a man that drinks. If you drink one drink, and next thing you got 20 going down your throat, then just leave it alone.
Yeah, that's a very good comment. And I know that we've all gotten to the point now where, you know, we don't put additional salt on our food once it's on the table, right? We're not still doing that, are we? All right. Let me go to the next. I got it.
What is involved with cardiovascular disease screening? And who should get one?
Okay, he said, what is involved with a cardiovascular screening and who should get one? Every one of you guys have Medicare in here. Amen. If you don't, you close. Let me tell you what.
Yeah.
This is not hard. That's what's wrong with society. This is not hard. Every year, Medicare send you out a link that tells you your annual screening exam, this is what you should have. If you don't have diabetes, a glucose every year. They tell you how often you get a PSA. They tell you how often you get mammogram. They tell you how often you get a colonoscopy.
Doc, can you speak in the mic? We're recording. Thank you.
All that stuff is on that list. Medicare send out a list of all the things that you should get every year on your annual wellness exam. If you're not getting the annual wellness exam, if you don't qualify, then you should get those things on that list. In fact, for African American men, colon cancer and prostate cancer is the one that I'm really pushing, because it used to be 50, now it's gonna drop down to 45. It's dropping on, you know why they're dropping down? Because they finding people at 40 having prostate cancer, people at 30 is having colon cancer. So you gotta drop down to get the majority of the population involved. Your doctor should know all that, because the reports is out there. You can go to the CDC website or Medicare.gov and put annual wellness. It'll tell you exactly what you should have, when you should have it. Now, if your doctor don't do it, you ask for it. It's your health.
We've got one on this side of the room, and then we're gonna come right back to the student.
Yeah, I got a question, which I worry about the long-term use of like Cialis or Viagra. Right, does that affect you long-term if you've been using that for like a while? Should you alternate between the two? I know that the two are different in some way.
Yeah, you should worry about the long-term effects of Cialis and the long-term effect of Viagra. Now, when you take a medication, your doctor prescribed that medication, the FDA approved that medication based on something called risk versus benefit. Nothing is without risk. If you have a problem, medical problem, or personal problem, that medication take care of, you have to figure out, do the benefit I'm getting from this outweigh the risk? Outweigh the risk? That's what you have to look at. Now, basically, they are pretty safe medication if you use them properly. Now, where you hear about all these bad things happen to people on the medication is someone who uses the medication and don't follow the guidelines. They're taking nitrate-related drugs. If you're on nitrate-related drugs, you should not be doing that. They're taking a double dose because they want to get a double pump.
All right, the other two, Shane and Bill. Right here, Don.
The A1C, I'm sorry, I didn't need an A1C. Who should get one and what should be done?
Okay, first of all, this is gonna be my next slide before I got cut off.
It's coming back around.
Here's a goal of things that you should know about, you should be having, that you should know about and should be. Your blood pressure, they said 120/80, but recently 120/70. And let me just tell you, in certain people like diabetes and people with kidney disease, and they should go down lower. Let me tell you where all this data came from so you can understand. Because these are just guidelines. These are not goals, brick rules. This data came from large study who looked at people with blood pressure 150, 140, 130, 120, 110, and so on, 100. And what they found out that if you lower your blood pressure down to 115 systolic, that's where you get the best result for reducing cardiovascular disease versus the risk of falling out and getting too low. Because you get too low, you're gonna pass out, and who cares whether you have heart disease or not, you pass out driving down the road, okay? So what this group of doctors are designed to get together every so often, they get together and they figure out what's a good number that's safe. It's a good number that's safe, about 120/7. That don't mean yours have to be. If yours is 110/60 and you're feeling fine, not dizzy, then fine, go for it. If you get it down to 140/80 and you start being dizzy, oh, just stay there, buddy. Don't push it. Okay? All right. Now, A1C. Now, what's important about A1C? A1C should be below 5.7. Now, it used to be, you remember when you went to the doctor and they said you got a touch of diabetes and then they didn't do anything about it? And then they assumed that you was okay. That's not right. We know that people who have a touch of diabetes, in other words, with A1C of 5.7, 6.4, call them pre-diabetic, what do you want to call them? They have a significant 25% increase in having cardiovascular disease and stroke compared to somebody with A1C of less than 5.7. So that tells you that pre-diabetes is really that. I tell my people when they have elevated glucose, A1C, and the fasting is 120, 110, 109, or whatever, I said, you have diabetes. They don't want to hear it. I'm trying to help you, and you don't want to hear it.
Excellent, excellent, Dr. Flowers. We've got one on this side of the room, and I think we're gonna have time for maybe two more after this one, okay?
I got 2 minutes. I got him.
Yeah.
I got you.
Dr. Flowers,
Yes.
would you discuss the need for CPR training in the Black community?
Yes. I just got mine renewed not long ago. I think every single person should know how to do basic CPR. Not necessarily Black, every single person. And it's not that hard. I mean, you need to know if somebody pass out sitting beside you, you need to know how to check them to make sure they got, it's not a circulatory problem, a respiratory problem, or they didn't choke on their sandwich. And that's crucial because each one of those treatments is different. So I think every person should have CPR training. Every person. I try to get it set up in my church, and most people, I don't need all that stuff. I ain't gonna fall out. Oh, come on, guys. It doesn't cost you anything. You get CPR training, you can get the certification training in 45 to 50 minutes. Okay? I mean, some people may take a little longer because to get the technique down, but so what? If it's 3 hours, so what? What are you gonna be doing? I always tell people, like I tell, I mentor a lot of students at Emory and all, and they want, oh, that's too hard. I said, what are you gonna be doing at 10 o'clock at night if you're not out with the guys, you know? I mean, think about it. What will you be doing in that 30 minutes, 1 hour, whatever time it takes? Every single person should have it.
Got it, right here.
Dr. Flowers, it's great to see you again. I haven't seen you in a long time.
Okay.
I just wanted to ask you, is lisinopril one of the medications for high blood pressure that has a negative influence primarily within the African-American community, and is amlodipine or other drugs like that more successful in treating high blood pressure?
In general, because we all have different that's why we got biomarker, biometric, we're different. Different ethnic group are different. And basically, diuretic and calcium channel blocker tend to work better in lowering the blood pressure in African American because of that sodium but the lisinopril has other properties that give you an edge, give you a benefit. If you have kidney disease, if ACE that's a class called ACE inhibitor. If you have kidney disease, or if you're diabetic, or if you have heart failure, or if you have a weak heart muscle. I like to correct it because people think about heart failure. I hear people like, I have heart failure. You don't have heart failure. I mean, what is heart? Heart failure is when your heart is unable to pump the adequate amount of fluid through your system that it should, and it backs up into your lung, and you get what's called pulmonary edema. So you get extra fluid backing up into the lung because the heart can't punch it forward. It doesn't mean a cardiac arrest or nothing like that when you're going to rhythm. It improves those things. So Black folks should be on ACE inhibitors, okay? The Lisinopril and those type of drugs is the category. That's why you go to a doctor to assess you. If you have high blood and have no risk, no heart disease, just hypertension, stage 1, we got them stage now, stage 1 hypertension, then the main factor there is controlling the blood pressure. You're not worried about the other stuff because you don't have it. Then of course, 5 milligrams of amlodipine might be the answer, or 10 milligrams might be the answer. A little diuretic might be the answer. And by the way, you might be thinking, some people get a call, especially African Americans, with ACE inhibitors. It's the inosine, nobody knows why. And you can be taking this drug for a year or 2 years. And they may get cough and they may get something called angioedema. Face swell up, tongue swell up. But you can't predict it. I mean, you may be taking the drug for a year and all of a sudden your face starts welling up and get tingling. And what you do then, you call 911.
Yeah, Dr. Flowers, I hear a lot of gentlemen talking about Cialis and Viagra. Also, for long-term use, it kind of affects your eyes, but you also use Edix, for that injection into your penis. Might help those brothers out also.
Yeah, there are a lot of things. There are a lot of things you do to improve your sexual health. In addition, we learn now that exercise improves it. We also learned that you can get a suction pump, child penis, you pump the thing up, and then you can get ultrasound treatment to your penis. In other words, just get the vibrator and put it on. It'll help you erect more prominent. I mean, there's a lot of things you can do. I mean, I'm not an expert in ED, but I know there are a lot of things. The injection, you got this girl out of dating there. You don't say, hold on a minute, honey. Let me fix this.
I got one right here, and then we'll come back to you.
Hey, Doc. So last month, I talked to my dad, and he had just had a heart attack. And I asked him what he was doing when he had the heart attack, and he changed the subject. So we know what he was doing. But that made me so nervous that the next time I went to my PCP, my blood pressure was 151 over like 79. And she said, you have high blood pressure and you have high cholesterol. I said, I've never had high blood pressure in my life. We sat there, I talked to the doctor, and I asked the doctor at the end, can you take my blood pressure again, just to see if it was based on my nerves? And she did, and it went down to 121 over 90. Can you talk about how stress impacts our blood pressure and whether or not we should get that test done when we first walk in or towards the end of our visits?
Okay, checking blood pressure. Many physician offices do not check the blood pressure the way it should be. And I am proud to know that I had my annual wellness exam a few weeks ago, and my provider did it the right way. Because I went in there and I sat down and I had my leg crossed. And she said, uncross your leg. And I did. And she took it. It was borderline elevated first time. And then she said, take 3 deep breaths and just relax for a minute. And I did. And it went down like 118 or something like that. Now, bottom line is, you should not have your blood pressure taken the sooner you walk in the office. You should sit down. You should be seated, relaxed for maybe 10, 15 minutes. You should have both feet on the ground. You shouldn't have your arm crossed. And the blood pressure machine should be close to the level of the heart. And you shouldn't be holding it up. It should be rested on something. Now, given all that, if it's still elevated, there are a lot of people that have blood pressure that goes up when they are stressed. Now, you might say, well, but it was normal when I was sitting there relaxed. No, listen to me. If you have a job or a situation where you're stressed 8 hours of the day, you go home relaxed and it's fine, and that means 8 hours of the day, your heart, that little muscle, that burning fingers muscle that works all the time, is working harder than it's supposed to during those 8 hours. So management of stress, exercise, things like that can help with that.
Good morning, Dr. Flowers.
Yes.
With a pre-diabetic diagnosis and the A1C level that is just, moving in that direction, is there a natural approach by diet to bring that down below that threshold?
Yes, there is, but let me tell you what I recommend. If your parents have diabetes, if you had a random elevated glucose, or if you say even borderline, start acting like you're diabetic. The exercise, 150 minutes a day, the eating, stress, lifestyle modification, because stress runs your sugar up, your glucose, because stress stimulates the adrenal system, and the adrenal system can run your blood pressure as well as your sugar up, your glucose. I don't want to use the word sugar, but your glucose up. So start acting like you have to. I always tell my patients, you need to start acting like you would, I just got to touch him. No, start acting like you have it, because then you will delay the onset of it. You get maybe older when you get it.
Well, it's been an excellent presentation. I want y'all to give Dr. Flowers a few. Again, apologize if we weren't able to get to all of your questions, but again, Dr. Flowers he'll be back, I promise you. And you guys just keep coming back, okay? Because we'll get to him eventually. We appreciate that.
And a lot of the stuff is on YouTube that you can look on, Google it on YouTube, and it'll tell you just how to do it. There's no excuse.
Just a quick announcement. Thank you, Dr. Flowers. Just a quick announcement about the research forms. Again, as Cornelia mentioned earlier, if you've already turned in a research interest form, we don't need you to fill out another one. But if it's your first time and you are interested in being contacted about research, please, let's get those collected and turned in right now. Thank you so much. And hold on, we've got another treat for you. We just talked about what we need to do to take care of our business, right? Come on, John. John, come help us out. Where's John? John is our exercise guru.
All right. Good evening, good evening. Why you sitting up? I always say thank you for coming. And for everybody that's new, the rule is go at your own pace. If you don't want to do something, you're not cheating me. You're only cheating yourself. If the doctor says don't do it, do a little bit. Do a little bit. Remember, the move that I'm getting the cardio in, but I'm thinking about every machine that's in a gym. Every machine that's in the gym, we doing it to a motion. We working on them hips, those lower abs, that spare tire, that upper body. So let's get it done.
Morning soon, morning soon, one morning soon, my Lord, one morning soon, I heard angels sing. One morning soon, one morning soon, my Lord, one morning soon, I heard angels sing. My love, my brother, how you walk across, I heard angels singing. Your footman lift your soul, Lord, I heard angels singing. One morning soon, one morning soon, my Lord, one morning soon, I heard angels singing.
Right now. I'm getting out of chest and my hands are wide. Watch now. I'm coming inside. Let's go. Took all my rights away. If you're telling me how to pray. Keep that. If you won't let us demonstrate. Watch. Shoulders. Get left. Shoulders. Get left. Watch. Open my run. Oh. We are the lions. We are the chosen. We are the shine. Bring it back up. Watch. I added that weight in. You gotta know. Watch it. Some said fire when the fire was hot. Let's go. No, Good. There you go. You looking good. Cool. No, I'm in this life. Call my rights away. Come on. How to pray. Come on. Come on. Circle. Get it. There you go. Watch this. Wow. Oh. We are the lions. Right.
Don't you know, talking about a revolution sounds.
Good hamstrings right now.
Don't you know, talking about a revolution sounds. While they're standing in the welfare line,
feel good.
Crying at the doorsteps of the army of salvation. Wasting time in the young more than hours. Sitting around, waiting for a promotion. Don't you know, talking about a revolution sounds. Hey! People gonna rise up, get there, yeah.
Hold on. Oh!
People gonna rise up and take what's there.
Why? I never have a playlist order. I be jumping around and I just feel the room. I just switch it. So sometimes I have to find a song when I feel it. Not from the A. Atlanta, that's how we do it. Hey!